The Honourable Taylor Martin.
Thank you, Madam Deputy President. I rise to speak on this motion, and I'd like to speak about the 2016 Wellness Walk that was held on Sunday the 16th of October in Sydney. I'd like to note that it involved the participants walking 5 kilometres from Government House across Sydney Harbour Bridge and returning to Government House once they crossed the bridge. The Wellness Walk raises money for several charities to deliver innovative and much-needed mental health services for people living with mental illness and their families throughout New South Wales. Madam Deputy President, it's now in its 4th year the Wellness Walk was held across several locations in New South Wales, not just Sydney, so it includes also Port Macquarie, Ulladulla and Wagga Wagga. It's a great event, Madam Deputy President, and it aims to raise awareness of mental health issues and to encourage walking as a way of improving our state's mental wellness. And the walk across the Harbour Bridge is symbolic of bridging the gap between the stigma and understanding of mental illness and mental wellness. Furthermore, gathering together shows the community support and care to anyone who is suffering from mental illness in our state. The act of walking reflects that living with a mental illness is a step-by-step process, and to resolve it is just a one step at a time process, Madam Deputy President. In addition to boosting the circulation and lowering blood pressure of participants, walking has been proven to provide many health benefits, including reducing depression, stress and anxiety. And I'm sure many members in this House can appreciate the kind of exercise that's needed to reduce those levels of stress and anxiety from day to day. By taking better care of our own mental health, we can automatically engage in a practice of self-care, which in turn leads us to take better care of those around us. October is Mental Health Month, and it's an opportunity every year to promote mental health for residents across New South Wales. Are You OK Day is another great example that we can participate in each year. It's a national event to inspire all citizens to help reduce suicide and depression by reaching out and making contact with those around us and asking, are they okay? Suicide and attempted suicide are human tragedies with many contributing factors. Over 2,500 Australians die by suicide each year. This equates to almost 7 deaths by suicide each and every day in Australia. Our government recognises the need for an integrated approach to suicide prevention and has invested a range of initiatives to ensure that people at risk of suicide, as well as their families, friends and co-workers and carers in some case, are connected with the treatment and support that they need. Our government is committed to improving the wellbeing of people in New South Wales, especially in the area of mental health, and improving the outcomes of people more broadly in our society. Madam Deputy President, in Australia, 1 in 5 people will experience a mental health problem within a 12-month period. With this in mind, it's important that we have a focus on strengthening prevention and early intervention for mental health issues. In the 2016-17 budget, our government committed $1.8 billion to mental health services in New South Wales, which is an increase of $106 million upon the previous year. Our government is integrating community mental health services into mainstream services and training youth workers in mental health first aid and implementing a community living support program for young people, which is something that I'm pretty passionate about, as you know, and also promoting wellbeing in schools, which I've spoken about before. And this is something that year on year we are improving on, Madam Deputy President. Some measures include $8 million over 4 years to establish a new suicide prevention fund to support mental health non-government organisations to prevent suicide throughout our community. $3 million in continued support for Lifeline's 131114 crisis telephone service on a 24/7 basis, as well as providing mental health training and supervision for the telephone crisis workforce that Lifeline maintain. $500,000 for specialist suicide prevention training for New South Wales Health's non-mental health clinicians in the frontline roles to strengthen their skills in identifying and responding effectively to individuals at risk of suicide. Madam Deputy President, there's $1.2 million to continue the rollout of the Project AIR strategy for personality disorders across New South Wales, and this involves training clinicians to respond to people who have self-harmed and to develop local follow-up support services. The annual wellness walk is very important to the people that partake in it and the people that it affects. It's a great opportunity to promote mental health issues, and I encourage the public further to support and promote the wellness walks and other initiatives taken throughout the year to raise awareness and support for mental health. Thank you, Madam Deputy President.